So the most important thing that's happening for treatment of PBC nowadays is our recognition that we want to achieve the best biochemical response and stabilize the disease to prevent progression of disease. And a lot of research over the last 10 years has shown that improvement in alkaline phosphatase and bilirubin should be focused on as close to normal as possible to achieve the best long-term outcomes. We also now are focusing much more on patient-reported outcomes, such as symptom burden of itch and fatigue, because some of the new therapies are focused directly on improving those symptoms, which are obviously of great importance to patients. The two medicines that have been recently approved by regulatory agencies are elafibranor and seladelpar. And these are PPAR agonists. And what's unique about these medications is that not only do they achieve biochemical response, but they have the potential for normalizing an alkaline phosphatase and potentially preventing symptoms from getting worse or possibly even improving symptoms such as itch. There's data suggesting that we might even be seeing improvements in symptoms such as fatigue, which is obviously a very disabling symptom for patients with PBC. So these two new medications being approved has been a major advance for PBC, both in terms of disease modification, but also symptom improvement. So we've learned that not all PBC patients are exactly the same. Patients who are younger at diagnosis have very high levels of alkaline phosphatase, and patients who have some other disease-modifying autoantibodies, such as SP100, may progress at the most rapid rate. So trying to identify those patients that are at greatest risk for accelerated progression of disease is critically important in intervening earlier to stabilize the disease and prevent progression. Over the next 12 to 24 months, the most important factors in development of PBC therapies are going to be potentially improving therapies such as IBAT inhibitors that specifically improve itch, and also better data on prognosis and developing more precise models to stabilize the disease as we get long-term extension therapy with the approved PPAR agonists.